Hello everyone, my name is Dr. Aashish Chaudhry. I am heading the Department of Orthopaedics at Aakash Healthcare Super Speciality Hospital, New Delhi, India. Today I am going to talk about a very important topic, that is the joint pains and why you should not be ignoring even the earliest signs of joint pains in the body. So let me tell you friends, joint pains, although superficially or in the early stages, can just be ignored as a small abrasion in the body or the daily routine of life. But let me tell you, joint pains can be devastating. It can progress very fast and can cause multiple deformities and debilitating movement disorders in patients. Whenever somebody is suffering from a joint pains, we need to look at the entire history, since how long the joint pain has been there, what was the progression, whether it was a sudden onset or a slow onset, whether it is constant at this moment or it is progressive or it is gradually increasing with time. So these are the history points or the important signs and symptoms which have to be looked into. What all joints are affected, that also can point towards the diagnosis. For example, if we have a age-related arthritis, most of the time it is a weight-bearing joints like knee joint, ankle joint or the hip joints which get affected more. Somebody who is a wrestler or doing activities of heavy lifting, they can have the joints of the back or the spine, or the hip joint or the lower limb joints can get affected in those patients. Person who is majorly doing the upper part of the body exercises or using the shoulder, there can be overuse activity of the shoulder muscles and the bone, and hence they can have the shoulder joint problems. Likewise, there are some arthritis which can happen because of the autoimmune disorders like rheumatoid arthritis, or sometimes there are other autoimmune diseases which can affect all the joints of the body, primarily starting from the small joints of hand and feet. In those cases, you would find a lot of morning stiffness, especially in the early phases of the disease, and unless and until you take a proactive step and consult a doctor, that disease can flare up within no time. So joint pains should not be ignored. One should always consult or take a physician opinion or orthopedic surgeon opinion to actually go to the correct diagnosis and then plan the treatment. In today's world, where the 40 is becoming the new 60, there because of the sedentary lifestyle, because of too much activity on in a sitting position on a laptop or a system, that has actually caused a lot of joint pains happening because of the postural changes. Human body is primarily meant to be in motion most of the time, but if you abuse it by sitting for long hours, especially for more than 1 or 2 hours at a stretch, and that too in a very abnormal position without having taken care of the ergonomics of the body in sitting posture, one will within no time will develop obesity, especially the truncal obesity, and that can indirectly affect the back muscles, the back joints, and also because of the long sitting, the muscles around the knee joint and the other lower limb joints also become weakened, because if you are not exercising well, the joint muscles which actually support the joint, they start losing the strength, and hence all the joints start becoming more prone to the injury. So one has to look at changes in the lifestyle, one has to look at changes in the nutrition, because unless and until we take care of our protein intake, we balance out the carbohydrate and fats in our normal diet, we will not be able to continue to maintain the muscle bulk around most of the joints or the large joints of the body. And if you don't maintain the strength, the joints are going to get worn out much faster than we actually predict. So these are the areas where one has to look at. The communities have to, go out of their comfort zone, must get involved in one or the other physical activity, whether it is sports, yoga, or any kind of physical movement which can really change the way the muscle tone will develop, and also it will keep the joints protected. So overall, joint pains can happen all across the body, starting from the cervical spine, the neck joints, to the shoulders, to the entire spinal region, and then the lower limbs, because we walk on both the legs, and that carries the body weight. So one has to be very meticulously planning the activities what the person should do. So joint pains must not be ignored at any cost, and one should consult a physician, consult a doctor to get to the right diagnosis and then plan the treatment and the preventive strategies accordingly. Thank you.